All right, welcome everyone. Thank you for being with us today. We are hosting a Facebook Live back to school Delta variant update session with Dr. David Brooks, our medical director of infectious disease, and Dr. Jennifer Frank, our chief medical officer here at ThedaCare. I'm Cassandra Wallace with our public relations team. Thank you all for being with us today. As always, with our Facebook Lives, we will be taking as many comments and questions as we possibly can. I am monitoring those lives, so please leave them in the comments and we will get to just as many as possible. And this is your time, absolutely. Ask the questions that you have been wondering about as kiddos are heading back to school, or if you have a question about vaccinations or where we are right now in the pandemic, our experts here are willing to answer those questions. So let's get started today. Dr. Brooks, I want to start off with where we are in the pandemic right now. What is going on with expected surges, and just kind of give us an update if you can.
You bet. Unfortunately, we're still talking about COVID. The pandemic is not over. We've been through this before, well over a year into this, two major waves, but we're into another wave now. The virus continues to change. There's a new variant going around, Delta variant, which I'm sure you've all heard about. We're learning more about this month by month. So far, what the data and science is showing us that this variant is even more highly transmissible than the prior COVID viruses. So we're seeing significantly more cases across the US and other countries, as well as locally. Most of our 9-county region is in high transmission again. So it's much more easily transmitted, and we're seeing not only spread of the virus in people that are not vaccinated, but we are seeing cases even in people that have had the vaccine, so that they can continue to spread the virus. And this is really hindering our ability to contain the virus, which is why we need to talk about multiple ways to mitigate and slow the virus down. We have seen more people getting sick, more people in the hospital again. So it's concerning, but I think we have some solutions. But I know you have many questions, so I'll stop and take the questions.
Perfect. Thank you, Dr. Brooks. It's a great update for us. I'm sure not many people probably thought we would be in this situation again, a year and a half into the pandemic. Dr. Frank, what are you hearing as you chat with patients and families right now? Is there still concern about, COVID and vaccinations? It's probably a different discussion than what it has been.
Yeah, I mean, certainly the conversation is evolving. There always seems to be a new topic with COVID that is ripe for conversation. So I think most recently we've been talking a lot about vaccinations. I'm strongly encouraging people to get vaccinated. I think now so more than ever, it's very important with people going back to school and the Delta variant kind of running amok across our communities. So there's a lot of questions about vaccination, a lot of very individual concerns about vaccination. Unfortunately, still quite a lot of hesitancy about vaccination. There's also questions about how to make this transition back to school, or questions people have about the ongoing stress and anxiety they're experiencing with COVID, questions about travel and returning to work, and what their susceptibility is, all of those types of things. So unfortunately, still quite a few questions. I think we are better prepared than we were a year ago to answer them. But again, we are continuing to learn together.
Thank you. So now that we've kind of set the playing field of where we are right now in terms of the pandemic, I do want to remind everyone that we are taking questions live. I'm monitoring them here in the comments. So please take this opportunity to ask Dr. Frank and Dr. Brooks those questions that you have been wondering about over the last couple of months. Maybe you have something specific as in regards to back to school, or something that you've been hearing in the news lately. This is your opportunity to take that time with them. So I really want to talk about vaccinations first. This seems to be a topic that we're hearing about quite frequently, especially with some news yesterday. Dr. Frank, we'll start with you. We know that the Pfizer vaccine now has more approval from the FDA. So what does that mean? And does anything really change at that point?
Sure. So this is not unexpected. We anticipated that the Pfizer vaccine would get full FDA approval this fall. We're really pleased to see this because for some people, this does add an extra layer of confidence in both the safety and the effectiveness of the vaccine. Substantively, nothing has changed. The vaccine that we are giving, 2 days ago is the same as the vaccine today, even though that approval has been granted. But I think it just really speaks to further confidence in the fact that our initial confidence in the vaccine, which both Dr. Brooks and I rolled up our sleeves to get that vaccine as soon as we were able to, really has just been borne out by a wealth of data. We've had hundreds of millions of people vaccinated, and so have been able to collect a ton of data on both the safety of the vaccine as well as how well it's working for us. And all of that data taken together is really what led to the approval of the vaccine. So the Pfizer vaccine is now FDA approved, just like your flu vaccine is, your measles, mumps, and rubella vaccine is. And we're really hoping that this will increase people's confidence, as well as it may change some behavior around vaccine mandates and things like that, as now people may feel more confident requiring a vaccine that has full FDA approval.
Thank you for that update. And again, we are taking questions and comments here. Dr. Brooks, I do have a question from Paula, who's asking, the only vaccine available at this point for kids is Pfizer, is that correct?
Yes, that's the only one that's been approved down to age 12. So we're still collecting data, and the FDA is going to review other vaccines for consideration in the near future of the 3 available vaccines. They're looking at data. So it's possible that may change, but for that age group, 12 and above, Pfizer is the only choice. The other 2 vaccines are only for adults at this time. As we get into this farther and farther, there is more data, and there have been some ongoing trials. So like everything else, stay tuned. There'll be more information coming. And this is, I think, the next age group that we really need to get protected. With fall coming, school starting, this is that age group that we are seeing more cases now, which last year we did not. The hospitals are seeing more admission in pediatric patients. Fortunately, not severe illness in most of the cases, but as this thing changes, we need to find ways to protect the pediatric patients as well as the adults and other people, really everyone in the community. So we need to get this done. We're making good progress, and we hope we get there soon.
Oh, Dr. Brooks, you just stole my next question. That was exactly what I was going to ask you. I want to talk a little bit more about kids and COVID. And Dr. Frank, we're going to come back to you in just a moment, because I want to talk about ways that we can help parents and families transition back to school to help maybe take some precautions in place there. So Dr. Brooks, I do want to ask you first, you hit on it, that we are seeing more pediatric cases because of the Delta variant. So, you know, we always heard that COVID wasn't necessarily, I guess, risky for children. Is that changing, and why?
It has. I think many of us thought last year that it was not a serious illness in the pediatric population when this first started. We saw very few cases in the pediatric patients, very few serious illness. But with this latest curve and the Delta variant, we are seeing 15% of cases now in the pediatric group. We're seeing young adults that previously had not had serious illness come into the hospital with more serious COVID. So this is affecting the younger patients, not just the old and people with immune problems or other risk factors. So this is a little bit more, I think, scary to many people in the community. As a father of 4, I'm concerned, even as a physician. So I think we, again, just have to look at every which way that we can mitigate and reduce the risk factors here. It's going to be starting soon with school and other group activities, more indoor crowding together. It's going to be a combination of being vaccinated and probably other strategies. I know no one likes to talk about the masking, but social distancing, masking, hand washing, cleaning, all of those are critical. And as parents, please vaccinate yourselves. That's the first step in protecting the family, is vaccinate yourselves as soon as possible. It does help. You're less transmissible when you're vaccinated. If you do get sick, you're not sick as long. So there is some data to support that. Your immunity lasts longer. There are benefits to getting the vaccine, despite what you may be hearing on the internet. There's a clear benefit and a very low side effect threshold.
Great, thank you for that answer. We are getting some Wonderful, wonderful questions. So I'm going to try to get to as many as we can. Dr. Frank, this one's for you. Paul is asking now with that FDA full approval of the Pfizer vaccine, and you touched on this a little bit. Do we anticipate more people feeling comfortable now with that and maybe getting the vaccine where they might have felt hesitant before?
Yes, I think so. There have been some studies that indicate that about 30% of people who have refused the vaccine so far would be willing to get it if the FDA granted full approval. So we certainly expect that that's going to be the case. In my own practice, I would say that's probably about accurate. Maybe about 20% of people who are hesitant about the vaccine are hesitant for the reason that it's not been approved yet. And so we certainly are hopeful. And truthfully, I think that's one of the things that we've been very hopeful for, is once this approval comes through, that would again help to encourage a certain segment of the population to get vaccinated.
So we have Pfizer now with this full approval from the FDA. What's next for Moderna and Johnson & Johnson?
They're highly motivated to get full approval. I will say that. So they're just a little bit behind timeline wise. And so I anticipate that those will come through as well. The data, similar to Pfizer, has been overwhelmingly in support of both their safety and their efficacy, which are the two primary things the FDA is looking at. So I anticipate that those will come through soon.
Great. Thank you for those answers. Again, we're getting wonderful, wonderful questions. Please continue to add your questions in the comments. I'm monitoring those live and we're getting to as many as possible. Let's see here. We will go to Kathy. Kathy is wondering, Dr. Brooks, about boosters. We've heard a lot recently about boosters, additional doses. So can you kind of walk us through those guidelines that have recently come up from those who are immunocompromised? And then the next kind of phase with boosters for people who have been fully vaccinated and are in that 8-month time frame. I know those details are missing just a bit right now, but can you kind of give us an update of where we're at, Dr. Brooks?
All right, I think the idea of needing a booster is familiar to most of us. We all need boosters for tetanus shots and flu vaccine each year. We know that the immunity you get after one vaccination does not usually last a lifelong in most cases. So they've been looking at the data, antibody titers, other factors over the past year. And right now, based on the data, they've determined probably the optimal time to get a second vaccine booster is probably about that 8-month time period to keep the antibody titers and the immune protection at its highest level. They will be looking at this for other vaccines too as well. This is just getting started. They, I think, decided to start this in the patients with the highest risk. Many patients that have immune problems going through cancer therapy, autoimmune disease, transplant patients, may not have mounted a great response after the initial vaccine. So they're more at risk than an average patient. So I think that was the impetus to start with them and get that operational. And then close behind that, they're talking about a booster vaccine for the general public in the very near future. It's been basically approved in terms of a conceptual idea. Now we're just waiting final FDA and CDC review. The vaccine committee is meeting next week, Monday, so they'll be coming out with more details shortly on the immunocompromised plan and definitions and phasing that in. And we are following those guidelines very closely. We'll be operational and offering much more clinics, different sites to make it as easily done as possible.
Great points, Dr. Brooks. And I do want to mention that this information about the additional doses and boosters, that's available on thetacarecovid19.org. We're constantly updating that site with the latest news and information where you can get scheduled. So we do just want to remind people that that information is out there, and it will help walk you through the process if you do meet the criteria, if you are immunocompromised, or if you're just, kind of waiting patiently for more information about those boosters that would be available, hopefully in the next coming weeks here. Dr. Frank, I have a question from Paula. She said that she's fully vaccinated, 2 doses. She is waiting patiently for that next piece there, the booster. She says she doesn't feel quite comfortable, going out in public and doing things that she used to. Will that 3rd dose maybe give her the boost that she needs? I know it's an individual choice of how comfortable that you feel, but what does that next dose do really for our immune system?
So it's kind of waking up the memory. So if you think about a vaccine as providing that similar protein, so your body can make antibodies, and those antibodies hang out. And a booster vaccine really just stimulates those antibodies once more to help them more easily recognize that protein, in this case, the spike protein, if it was to be seen again. And so similar to tetanus boosters or other boosters, actually many vaccines require a booster. It's really just to wake up that immune system to make sure that if you see that virus, 8 months, 10 months, 12 months after your vaccination started, that you are going to be able to fight it off. As far as comfort level, I think that's a very personal decision, and it's based on a lot of factors, and that includes who is vaccinated wherever you're going, what percentage of people are vaccinated, what percentage of people are masked, and then what's the overall community transmission.
Perfect. Again, lots of questions coming in about vaccines and boosters and things like that. Paul is asking how ThedaCare is getting information to the public when they are immunocompromised, or if they, are 8 months out from that second dose. Again, that's really, Paul, where we would encourage people to be checking that ThedaCareCovid19.org website. Continue checking our social media sites. In the media, we're always sending out information to the media. DrFrank and DrBrooks have been doing interviews like you cannot imagine. I'm constantly tapping into them, asking to speak with reporters when they have questions like that. So ThedaCareCovid19.org is a great resource. Our social media pages, again, trying to get that information to the public as quickly as we can when we do have that available for those immunocompromised additional doses or the booster. So good reminder there. I do want to touch on a few things for back to school, seeing some questions about that as well. Dr. Frank, we know that kids 12 and under are just not eligible to receive the vaccine at this point. Dr. Brooks hit on that point that we need to get there, and we're anxiously waiting for that. So I do have some questions here from parents asking, they can't get vaccinated. What are the best things that we can do as we send children back to school in person this year?
So, what's really interesting is last year we learned a lot about how COVID behaves in schools. And I think some of our initial fears about putting all those kids together and the concerns about how good kids would be at some of the infection prevention measures actually did not bear out. And what we found is that school-based transmission was fairly low. And I think part of that is because our educators in schools did an amazing job of helping kids to be safe, to wear their masks, to maintain social distancing, to monitor the community transmission and adjust appropriately. And so I was really very, very proud of all of our school systems. I think they just did a magnificent job in managing through a very uncertain year. And I think our rates of infection really were due to their diligence. I think part of the concern this year, of course, is some of the controversy around mask mandates. And as we go back into schools with large numbers of unvaccinated kids during a time when our community transmission is increasing and we are dealing with the Delta variant, I think there is a lot more concern. So, my strong opinion is that you should continue masking and washing hands and trying to socially distance and do all of the things that we know for a fact worked well last year. For parents of those who are less than 12, I would recommend that they are masking, whether there's a mask mandate in place or not, and not to forget the value of things like hand washing and then staying out of school if you're sick, doing, again, all of those infection prevention measures that help protect against COVID, plus help protect against flu and strep and all of the other viruses that like to hang out.
Perfect. Again, last year, we didn't really see the flu cases that we traditionally see in a year. The RSV cases, same kind of thing. Dr. Brooks, I have a question for you here. Joni had one specifically for you. She's saying, I had the Moderna vaccines. Can I get a Pfizer booster, or should you wait for the vaccine that you originally had from your first doses?
That's a great question. I think the immunization committee next week is going to address that for us. Right now, I think we're going to try and stick with the same vaccine that you had initially. So there may be kind of a staged approach here as they review data and then approve other vaccines for the booster. So unless they give us guidelines that we can mix vaccines, I would stick to that. Next week, I think we will get more details on exactly that question. So far, there's not much data that we can mix vaccines, and I don't think there's any data that you can mix a messenger RNA vaccine with the Johnson-Janssen vaccine, which is a different type. So I think I would continue to check our websites, talk to your physician about that, and we will be leading that as soon as we get that information from that CDC group next week.
Perfect. Lots and lots of those questions coming in. Mary Ann had the same question. A few others, again, had that same kind of question. So right now we're just waiting for additional recommendations and guidelines from official agencies. So again, continue checking social media and our COVID website. It's a great recommendation there. Paula is saying that her granddaughter last year was masked and didn't have a cold at all during the last school year. Something we've heard quite frequently. So DrFrank, you are in support of masking while in school. A lot of school districts are optional this year. How do we help kids? We know that they're resilient. They've done such a wonderful job when we ask them to mask, and they rarely have any issues with it. But again, how do we continue that encouragement? We're asking a lot of kiddos to continue masking for a year and a half. So how do we continue helping them?
So one of the things that I've certainly learned both in watching my own kids, but even in younger kids like my nieces, is the kids are actually probably the best behaved of all in doing this. So they're very, very amenable to the masking. I don't think it's a huge deal for most of them. And I would strongly encourage parents to continue to have their kids masked. I know that sometimes there's a lot of peer pressure. I even feel it sometimes walking into a store and I'm the only one with a mask on and you feel a little awkward. So I do get that. But I think reminding kids as to why we're doing this, the way that I look at it is we have really smart people who look at all of the data all of the time. In this case, the Centers for Disease Control and the American Academy of Pediatrics. And both of those organizations have looked at all of the data and said universal masking for everyone in schools is the best way to go. So as a parent, as I tell my kids, I'm in charge of you. What I can't control what other parents are doing. But my kids, again, I encourage them to be masked and would encourage other parents to do that. And helping kids to understand that people who decide not to mask are not bad people or anything like that. It's not that they can't be friends with them or, making character judgments is not something I would recommend. So just talking about how we keep ourselves healthy. So in that sense of, we eat right, we sleep, we wash our hands, we wear a mask. These are all things we do to stay healthy and well. And that's what we're focused on in our family, staying healthy and well.
Oh, thank you, DrFrank. I love that answer. We have so many people watching and commenting saying, thank you, agreed. Boy, if we could just, maybe share some examples from our kiddos. Boy, they do. They teach us wonderful, wonderful things. So kudos to all the kids out there. You're doing awesome. Keep doing a great job. Dr. Brooks, I do want to talk a little bit, you hit on it a while ago about kiddos and what the risk is from COVID. We've heard some very rare breakthrough cases of some complications from the vaccine. Can you discuss how rare that is and why getting the vaccine is better than the risk of contracting COVID if you are a child?
You bet. Yeah, I'm not a pediatrician, but as a father of four, we've been following this pretty closely and discussing this with our family practice colleagues and pediatrician colleagues. And like I said before, last year we did not see a lot of cases in the kiddos or serious illness in the kiddos, but this has changed. We are seeing a lot more higher cases, new positive tests in the pediatric population, for sure, 15% of the cases now. So that's a definite increase, and more hospitalization in pediatric hospitals across the country, especially down south. Children's hospitals are reporting more admissions due to COVID. Fortunately, most of those cases are non-life-threatening, but they're still serious. And there's still a lot of transmission going on in the community and families that put other people at risk as well. There has been some reports of this more serious condition, this multi-system inflammatory disorder, which is very serious. It fortunately affects a very small percent of the pediatric patients, but it is very serious and important to recognize if you do have a sick children at home, please keep them home. Do not send them to school or out. Be monitoring them, be talking to your private, physician about their condition. If you notice that they are looking ill, they're not eating or drinking, they're having trouble breathing, or they're, more lethargic, please call in, because sometimes these can lead to very significant problems where their organs start to shut down. They need to be in the hospital. And the good news is most of them eventually recover, but they do need help. They do need supportive care. So it's just important to recognize when that child is looking sicker than normal and to get professional help and guidance during that time. They will help you. They know the signs and symptoms.
Great recommendations there. Thank you, Dr. Brooks. Dr. Frank, I do have a question from Jan. They're asking, do athletes need to continue masking even if they are vaccinated? And I know, again, different school districts have different rules, but can you weigh in just a bit about that?
Sure. I think this is actually going to be a challenging school year for parents. Last year was challenging. This will be challenging in a new way. I know as I've gone back to the parent meetings with my kids as they're restarting sports, there are very few restrictions. There aren't visitor restrictions, there aren't spectator restrictions, no one needs to mask. And it's really made me think through how are we going to manage this as a family safely. So what I would recommend is that you certainly talk with coaches and listen to what they have to say and what they recommend. I do think, again, the coaches did a fantastic job last year keeping people safe. I think as far as masking, it really depends on the sport and the situation. And so I know I have runners and swimmers, and even last year, the masks were worn up until the point that it was no longer feasible to do that. And so I would really recommend continuing masking like we did last year, where again, I know in cross country, you masked until they started running, and then there was some separation, and swimming, same thing, really tried to separate that. In other sports, you may be able to keep a mask on. And I know that masking gets a bum rap. Nobody likes to do it, but it really did make a huge difference last year, both with COVID and other infections. And so I think as long as it doesn't compromise an athlete's airway or make it difficult for them to perform, even on the sidelines and things like that, keeping that mask on is going to be so important. And this is really, I think, as parents, where we need to encourage our kids and have those conversations like we do about other things. Like, you're sometimes going to be the person who is saying no to the cigarette or saying yes to the mask or whatever it is. How do you do that? How do I support you in that? How do I help you be courageous in those moments? And why am I asking you to do that?
Oh, thank you, Dr. Brooks. Love, love, love that answer. I think this is maybe a good teaching moment for kiddos, whether it's mask or drinking or anything like that. It's how do you stand for what maybe you believe in, and do that in a compassionate way toward others. We had someone comment just a few minutes ago about thank you for not being bullying about masking and having those conversations. So I think that's wonderful, wonderful advice. So I want us to level set here. We have about a half an hour left of our time. We're taking live comments. This is really anything that you want to ask Dr. Frank and Dr. Brooks here. Delta variant, back to school, masking, vaccines. We've had some wonderful questions coming in. I'm continuing to monitor them, getting to as many as we possibly can. Thank you so much for all of your questions. We have 30 or so minutes left, so I'm going to keep going here with some of our other questions. Dr. Brooks, you briefly mentioned it, but as kiddos are returning to school and if they notice that they are feeling sick, they have symptoms, what do you do?
Yeah, I think you still need to follow your plan. You need to have a plan. I think most parents with kids have been through this before, whether it's school or daycare. When you see those signs, symptoms, or fever, you're going to have to take a time out. And the best thing to do is keep them at home. That's the only way to really prevent other kids and staff from getting sick in the school or daycare. And reach out to your primary physician group about, the best option, whether it's an in-person visit or just a test. In some cases, either one may be appropriate. We're going to have plenty of testing sites available for COVID and on the other respiratory illnesses when those start this fall and winter, and then get guidance about when it's okay to send them back. In many cases, they'll need to get a COVID test to reassure not only yourself, but your school that it's okay to come back. And we'll have that available. And with any kind of fever or respiratory symptom, it is going to be a good idea.
Great, thank you for that. And Dr. Brooks, I do have a question from Jennifer, since we're on the topic of testing. She's asking, is there a separate test for testing for the Delta variant, or is that just a general COVID-19 test and then they later test for the variants?
Great question. The COVID test is the same COVID test that we've done. We have several different types of tests, but they're generally just telling us the presence of COVID-19 virus. We do send many of our testing done of the DNA PCR types. We send those into the state lab of Wisconsin and other reference labs. They have the ability to do more sophisticated testing. It's more of a genetic test, a molecular test that hospital labs just aren't equipped to do. So they will be able to detect all the different variants, Delta and other ones that are going around. So they'll take samples from each hospital, from each part of the state, and then they'll submit data every week and tell us what strains are going around. So the short answer at this time, we really don't know on a specific test if you have Delta or not. We just know if you have COVID or not.
Good. Thank you for answering that question. Again, these are awesome questions coming in. Thank you to everybody who's watching. Continue asking those questions. We're taking them live. Dr. Frank, I do have a question from Amy. She is asking, how diligent do her elderly parents need to be? They're both vaccinated. How diligent do they need to be in continuing to wear their masks?
So that's a very good question, because I think that's a question all of us who are vaccinated are grappling with. What I can tell you is my own practice based on some of the newest data, and I think this is in line with what the CDC has found, is that if you are vaccinated and you get the infection, you can still transmit that to others, unfortunately. And so with that in mind, even when we're in a room of fully vaccinated people, we can never be certain that there's not someone there who has a mild or asymptomatic case that they may, potentially expose us to. So my practice has really been to revert back to my previous mask wearing habit, so that if I'm in a store, if I'm, outside really of my circle of folks, that I really try to wear a mask. If I'm outside, I'm more casual about it. But I would say for elderly parents, because their risk is so high at baseline, that I would encourage them to continue to wear the mask as much as possible. And to be safe, again, social distancing, if they're around people who are unvaccinated, to still be very cautious, similar to how they were last year, even though they're vaccinated, just to prevent that. Again, with Delta, we're just seeing increased susceptibility, even if you're vaccinated, and we just want to keep them safe.
Good recommendations. Dr. Brooks, I want us to chat a little bit about what we're seeing. We again started with this question of where we're seeing, the Delta variant spread, but can you talk about maybe what we're seeing across the country and how things have changed? It seemed like, when we began this summer, we were, at that really great point of we may be getting past this, and now here we are again. We're hearing that hospitals are at capacity. And it seems to be mostly unvaccinated individuals. Dr. Brooks, where are we at right now? And then what does that future hold for us? ThedaCare does modeling. We are anticipating a lot more cases coming up. Where are we, and what can we do to maybe stop this surge that we're expecting?
Great question. Yeah, I think most of us thought when the vaccine became available shortly after Christmas that would solve all the problems, would help us to get to herd immunity and really start the stopping process of this pandemic. But we have to remember, really, we're 50% vaccinated at best in most states. And Wisconsin's right about the average, and many of our rural communities are less than 50%. So what we've seen is this new variant after variant continue, and now we have Delta, which is higher risk of getting more infections. It is starting to ramp up and spread. The southern states got hit very hard the last few weeks with multiple hospitalizations, full hospitals. So we've had time to prepare that. And our model is showing that, we have started in this wave, and we will continue for the next 4 to 6 weeks through September and October with more cases in the community, more hospitalizations, and we need to be prepared and ready to do that. And we have our plans in place. Nothing, was let down. We were ready to go, and we're ready to handle that. I don't think it'll be as bad as the first two waves are, but it is a significant increase. The only way we can shut this down, I think, realistically, is with the vaccine program. We need to get up towards 80–90% of the population vaccinated, I think, before we really see this thing contained. And I think that's what most of the experts are talking about as well. Natural immunity helps, but what we know, it doesn't last as long and it may not be as robust. Patients that have had mild COVID do not have as significant long-lasting immunity as those that had severe COVID or those that have had the vaccine. So I think they really need to rethink about the importance. If you haven't got the vaccine, it is going to be better for you and really for your family and community to get vaccinated as soon as possible. Again, the epidemic continues. We're seeing more cases in the young patients and the pediatric patients, which we said that's different. So we're hoping that will not turn into more severe illness. We do have some patients in our intensive care units now, which, 2 weeks ago, we had very few people in the hospital. Now we've got many again. We were in the low 100s for new cases in the state. Now we're over 1,000 7-day average again, back to where we were. So it's coming back. We don't like it. I know you don't like it, but we're going to have to really dig in tight and start doing the things that we've been talking about if we want it to stop.
Thank you, Dr. Brooks. Thank you for kind of just giving us that overview. Dr. Frank, I have a lot of questions coming in, primarily for kids, and we're going to get to those in just a moment. I'm looking at comments in real time here, and this is something that I think we should address because I think it's coming up a lot. People saying that hospitals are brainwashing, that again, we've heard that this isn't real, that we don't need the vaccine. Alex here is saying, can your providers address this statement?
Sure.
Because we are hearing this quite a bit. So I want to get both of your opinions. You both have great expertise in this area. Dr. Brooks, you've been doing this for so long. Dr. Frank, you're seeing patients every single day and, hearing from families, and you're a parent yourself of young children. So Dr. Brooks, tell us, what are healthcare systems facing and what are our team members going through? And then Dr. Frank, I want you to address the same kind of thing. What are you hearing from our team members right now when they hear statements like that?
I'll go first. I think the first thing, it's definitely real, and it's very real for many of the patients that have risk factors and older age. It's very real when you come in the hospital and you can't breathe, and you're on an oxygen machine or a ventilator, and you can't talk to family or friends, you're isolated, you're not feeling well. I've seen husband and wives being admitted together. One dies, the other one makes it. I have sat and cried with families. I've prayed with families. It is very real, and it is very hard on families, not just the older ones. I put 30-year-olds on ventilators. Some have made it, some have not. So this is a very real illness. It's just not another mild cold. Some of us have had COVID and gotten over it, which is a blessing, but many people have had serious illness, and they will likely have issues later in life with long haul COVID symptoms, lung damage, heart damage, strokes, clots, lots of things related to COVID down the road that we're just starting to learn about. So if you can prevent it, I would strongly encourage you to listen to the advice, listen to the science, and really start thinking about what's best for you and family, because it's real. I'm telling you that. I know Dr. Frank will speak for herself. Talk to a nurse, talk to a physician friend, talk to a PA. They all have stories, and many of them are not very good stories. Many people have stepped up, and there's a lot of heroes here, but on the patient side, it's very sad in many cases.
Yeah, I would echo all of that. I think, I still struggle to understand where those kind of statements come from, because no one gains from making up COVID or anything like that, and so it's hard for me to understand. I think it probably come from a place of fear, is my guess. And I think a lot of us wish it were true that there was no such thing as COVID. But much to Dr. Brooks' point, the evidence is overwhelming that COVID exists, that it's as bad as people say. I know in my family, we just recently lost one of my aunts to COVID. So I know it's real because that's what she died from. And unfortunately, I think increasing numbers of us are having extremely personal involvement with COVID. From a healthcare standpoint, I think it depends a little bit on where you're at personally from a position of resiliency. And we've known all along that this was a marathon, not a sprint. We talked about that in March of 2020, and we're still talking about that. And we've really tried to focus on encouraging our healthcare workers and colleagues to stay healthy and well, to make sure that they're getting rest and they're doing all the things they need to for their own health, because we know this is going to be a long haul, and we want them to be well so that they can keep others well. I think where we really have opportunity is to have these respectful conversations. I don't have a lot of tolerance for falsehoods, particularly if they're harmful to patients, but I do respect that there are other points of view. But I think it is important for our communities to recognize that we still have extremely dedicated clinicians, physicians, advanced practice clinicians, nurses, as well as extremely dedicated non-clinicians. Our marketing and PR department, our administrative staff, our environmental service technicians. Really, we have whole thousands and thousands of people literally who are all under the umbrella of trying to improve the health of our communities. And we are doing that now. We will continue to do that tomorrow, and in just the best way we can every day.
Thank you both for that. I know it's not easy to answer those questions and continue to answer those questions. So we appreciate you. We appreciate your teams. We have Teresa here commenting, saying COVID nurse here. It's not a lie. So, we would ask the community to support our healthcare workers and continue that support as we, again, move forward throughout this pandemic. So thank you both for answering a difficult question, but one that I think people who are watching wanted to have answered. So thank you both for that. We have about 15 minutes left. Again, getting great questions here. So I want to get back to some of those. Let's see, Pam is asking Dr. Frank about breakthrough cases. So we know that getting the vaccine is never 100%, but what do we know about maybe breakthrough cases?
So I'm going to have Dr. Brooks fact check me on this one as well as the expert, but we are seeing breakthrough cases. Breakthrough cases are really just defined as a case in someone who should be immune. So someone who's vaccinated, for example. And what we're seeing over time, even just locally, is that the percentage of our patients who are breakthrough, meaning the percentage of people who are positive, who have been fully vaccinated, is increasing. The vast majority by far are unvaccinated. So vaccinated people are still faring much better. And that's particularly true when it comes to hospitalizations, being on the ventilator, or dying from COVID. But we do know that the breakthrough infections can occur. None of the vaccines are 100%. And as the whole conversation about boosters yields, there may be some waning immunity over time that requires a booster vaccine. The other is that Delta is a little bit different. And so that slight variation in how the Delta virus is configured can make it easier to elude the immunity afforded by a vaccination. That said, it is not an all or none. You're not immune or non-immune. So the vaccine gives you at a minimum some type of partial immunity. And similar to what we see with flu vaccines and other vaccines, that is enough in many cases to keep your infection, if you are going to get it, which is unlikely, but if you do get that breakthrough infection, to keep it mild or asymptomatic. And that is also very, very important.
And Dr. Brooks, would you like to add anything there when it comes to those breakthrough cases? Maybe
Yeah,
about
no, that was very well said. I think what we are seeing from a testing standpoint, about 20% of our new tests in the last few weeks have been in people that have had the vaccine. And that was surprising to us. That's unique to Delta. We thought this was going to be a highly effective vaccine, and it really is. It depends on your definition. What we have seen, it does protect against serious illness, hospitalization, and death. 90% of our hospitalized patients with COVID are unvaccinated. So there's very few in the hospital with serious illness that have had the vaccine. There's some, but it's still by far an issue with people that have not had the vaccine protection. I know there's a lot of information out there that's all over the spectrum. So just, again, be careful what you read. Read on the CDC or FDA sites. Read our site for accurate updates in that area.
Thank you for that. I do have some questions here from Denise and Jennifer, sort of on the same topic. They're asking, do we know our level of immunity after receiving the vaccine? Dr. Brooks, do you want to take that one?
That's a difficult question to answer, because no, we don't routinely measure antibody levels after we get a vaccine. In fact, we're not sure we would be measuring the exact right antibody. There's only a few tests available for COVID antibody testing, and it may not be the right one to measure the vaccine antibody. So a lot of it is based off the data with the vaccine trials, with that specific vaccine and specific antibody testing, and then looking at cases and the length of protection. That data is submitted to the FDA and CDC. We know certain people may not respond as well. Those with immune problems, cancer therapy, autoimmune transplant, they may not mount as robust of an immune response. So they probably do need to continue some additional measures even after their vaccine or their booster. And that's a good conversation with their physician or healthcare provider to have. But there is no magic test, unfortunately, at this time that says, yes, I'm good, or no, I'm not. It's just based on the vaccine trial data and how well they were protected based on those trial endpoints.
Got it. Thank you. Again, yeah, difficult question to answer. Thank you for providing a little bit more information there. Again, a few more minutes, taking as many questions as we can. Dr. Frank, I do want to touch a little bit more on kiddos going back to school and some information for parents and families who might be watching. Again, we know vaccinations are encouraged for those who are eligible. We know masking, washing hands, and things like that. It's, you know, kind of a common sense question, but why is it so important to keep kids in school and in person when we can?
Yeah. So I think that, you know, in addition to all of the benefits of masking, I think the past year has also shown us all the benefits of kids in school. And so really, even at the end of last school year, there were strong recommendations that any plan involving school and COVID involved kids back in the classrooms. And why is that important? Well, I think one is the social connectivity of kids. They are social creatures just like we are. And for many kids, having school at home meant that they really lost a lot of social connectivity. The second is that our teachers are awesome. They're amazing. And it's hard to do that over a screen. I know my own kids talked about how many of their classmates just went dark on the screen and went on mute and did who knows what. So that lack of involvement and accountability, I think we all suffer from that if we're not held accountable. I think also learning is a very interactive process. And so for those reasons, it's very important for kids to be back in school. Additionally, there's some safety nets that are at school, right? So there are people there whose jobs it is to make sure our kids have good nutrition and have physical activity, and that they're being monitored for depression and anxiety and other troubles, that someone's there to see if they're struggling with a specific learning concept. I think all of those things just fall away when kids are at home. And then I think, you know, knowing a few teachers who have just done an amazing, admirable job, it's really hard to teach virtually, and it's even harder to teach virtually and in person. And so I think just the stress on our teachers, we want them not to be stressed. We want them to be able to do their best job for our students, and asking them to do basically 2 jobs in one for a prolonged period of time takes a lot out of them. So for all of those reasons, it's super important for kids to be back in school, back in activities, back with their friends, back with their teachers. And we can do our part by being vaccinated, wearing masks, infection prevention, because that will keep community transmission low, and that in turn will keep schools safer.
Great. Thank you, Dr. Frank, for that. So a few minutes left here. I'm going to ask probably 2 more questions, one for each of you. And I always like to end our Facebook Lives with a question like this, because I think it provides a bit of a perspective for where we are. You know, Dr. Brooks, when we did our first Facebook Live in March 2020, I think this answer was completely different than what we would have now. So I always like to put it into perspective as we wrap up here. Dr. Brooks, again, we're 18 months into this pandemic. We probably did not think this is where we were going to be at this point. So, you know, you're seeing patients every single day, COVID patients. What advice do you have for our communities right now? Maybe words of encouragement or hope, if you have those?
No, you bet. I think we're still learning through this. We've made several projections and most of them have been wrong. The most important thing is to be a learner every day and be prepared and step up, which we have done. Our healthcare system has really done an outstanding job and listening to the science and the data to adapt and be flexible. So I think that there is hope. We have done an amazing amount of work, research, and operational things in 1 year period of time that's never been done historically. I think look at that as a blessing. We have been preparing for this. We've been expecting for this. I think it was not as we expected it in terms of the severity and how long it has lasted, but the things that we have learned, the way the vaccine has been developed and rolled out, never been done before on a national or a worldwide basis like this. So consider what has been done, the amount of effort from everyone involved, from researchers to clinicians, for people in the community, teachers, and just take advantage of everything that's available to you, because this may not be the last one. You know, we still have to get through this, but this may come again. So you have to be kind of prepared to have a plan that you're going to do what needs to be done to get through this. And we have solutions, we have alternatives, and we have options. Now it's just time to sit down and talk with your family, your friends, your loved ones, and make those tough decisions. And we hope we can get that vaccination up to 80%. I think that's what it's going to take. I know many of you have been through this before and you're tired and you're frustrated, and that's all normal. We're probably the same way. We enjoy what we do, but we don't enjoy seeing many of you so sick. And we don't enjoy missing out on activities in the community and with family, which we've all had to sacrifice, and the masking mandates. But we ask you to do it. We're doing it. We wouldn't ask you to do anything that we weren't willing to do ourselves. And so just please make those considerations in the next few weeks, especially.
Great. Thank you, Dr. Brooks. Great perspective there. And then Dr. Frank, since we are just on the heels of these kiddos heading back to school this week and next week, I'll end with this last question here of what advice do you have for parents and families as we are preparing to send our children back in another unique school year and situation?
I think, one, like has been said, vaccinated, wear your mask, all of those things. I think one important thing is not to relax your vigilance. You know, going back to school in a non-COVID year is the time when everybody likes to share their viruses and bacteria with everybody else. And so that's the norm for going back to school. And so staying vigilant, particularly in those first couple of weeks, not relaxing your guard, helping your kids to navigate what is a very complicated social environment right now. This is an opportune time to teach kids about kindness, civil discourse, agreeing to disagree, and also science literacy and understanding what data shows and how data can be manipulated. I think for parents out there, what I can share is that I have no higher calling than being a mom, and there's no one that I feel more protective of than my 4 children. And all 4 of them are fully vaccinated, and all 4 of them will be masking to the degree that I have any say over it. They're getting a little older. And that is because I care about them and want to protect them. And so would encourage other parents to do the same as we send our kids back to school, to just keep your kids safe, and then to really do what our community does so well, which is to take care of each other.
Awesome. Thank you both for taking time out of your very busy schedules to answer questions from our community members. Thank you all to everyone who commented. You had wonderful, wonderful questions. Thank you for the great conversation today. We'll continue monitoring these questions in our chat and respond as many as we possibly can. Again, we very much appreciate those questions and appreciate everything that you're doing, Dr. Frank and Dr. Brooks, and your teams and all healthcare workers out there. So again, thank you very much. We appreciate it.
Thanks, Cassandra.